enroll in Medicare Advantage are low-income people, and a lot of them are rural residents?
A lot of rural. I don't know the income levels, but I know there's a propensity is that you actually get a savings because you don't have to buy a supplemental policy if you're in Medicare Advantage.
And I would add to that, following along with my colleague from Oklahoma, there is the coordinated care. That's one of the advantages of Medicare Advantage. There's also the preventive component of this. And if we talk about ways to help people keep their health care costs down, it has to do with coordinating care and preventing illness. So with things we can do.
And we just heard we want to put a new preventative package into the program by the freshmen from the other side, but yet we want to take the preventative package out of Medicare Advantage. Interesting mix of amendments, isn't it?
Because we want to keep our seniors healthy. That's one way that they can stay out of the hospital, out of the nursing home, stay active. But yet this cuts Medicare Advantage, and the Democrats have voted to do just that, cut all of this money out of this program that seniors like. 11 million American seniors who depend upon Medicare for their health care choose this because there is an advantage to them. My colleague from Oklahoma, the other physician in the Senate, has talked, as I have, extensively about patient-centered health care, not insurance-centered, not government-centered. Medicare Advantage helps keep it patient-centered. So when I see about the deals that are being cut behind closed door, they're cutting out people from all across the country, and it seems that there's a sweetheart deal now to help just the seniors on Medicare Advantage in Florida to try to encourage one member of the Senate to vote a certain way. But what about the seniors from the rest of the country, whether it's Texas, Oklahoma, Tennessee, Arizona? A lot of seniors who have great concerns, and I would hope that they would call up and say, hey, this is wrong. We need to know what's going on, and why is it that there's a sweetheart deal just for one selected senator in one selected state when we want to have that same advantage? And why are the Democrats voting to eliminate, to cut all of this Medicare money?
May I ask my colleagues a question, maybe starting with the senator from Arizona, a related issue, which is Medicare Advantage is a private sector alternative or choice to Medicare, which is a government-run program. And I'm detecting throughout all of this bill sort of a bias against the private sector and wanting to eliminate choices that aren't government-run plans. Am I reading too much into this, or do any of my colleagues see a similar propensity in this bill?
Well, if I can respond to the senator from Texas, I think he's exactly right. There's a lot of very appealing talk that we hear from the advocates of the so-called health reform bill. But when we get right down to it and we examine it closely, we find basically a big increase in government-run programs. And what does that mean for low-income Americans, and what does it mean for seniors who depend upon our biggest government-run programs, that's Medicare and Medicaid? The risk that they may not have access to the doctor they want. The senator from Wyoming mentioned on the floor the other day that the Mayo Clinic, widely cited by the president and by many on the other side as an example of controlling cost, is beginning to say we can't take patients from the government-run programs in some cases because we're not reimbursed properly for them. So what's going to happen, behind all of this happy talk we're hearing about health care, is that we're going to find more and more low-income patients dumped into a program called Medicaid, where half the doctors won't see a new Medicaid patient. It's like giving someone a bus ticket to a bus line that runs half the time. And Medicare is going to increasingly find itself in the same shape, just as the Mayo Clinic and perhaps others will say we can't afford to serve patients from the government-run program. So I think the senator from Texas is exactly right. We don't have to persuade the 11 million Americans who've chosen Medicare Advantage to like it. In rural areas, between 2003 and 2007, more than 600,000 people signed up for it. They like it. And I think in a way the senator from Florida may have a sweetheart deal, but in a way he's done us a favor, because we've been trying to say all week that the Democrats are cutting Medicare. They're saying, trust us, we're not cutting Medicare. The senator from Florida is saying, Floridians don't trust you. You're cutting their Medicare Advantage And I want to have an amendment to protect them. And Senator McCain is saying, let's protect all seniors' Medicare Advantage.
Could I also point out to my colleagues, and for the record again, on September 20th, 2003, there was a letter to the conferees of Medicare urging them to include a meaningful increase in Medicare Advantage funding for fiscal years 2004-2005. A group of 18 senators, including Senator Schumer, Lautenberg, Clinton, Wyden, et cetera, including Senator Kerry, who now obviously wants to reduce the funding for Medicare Advantage. Again, perhaps he was for it before he was against it. Again, I would also like to point out, as short a time ago as April 3rd, 2009, a group of senators, bipartisans, including Wyden, Murray, Specter, Bennett, Klobuchar, others, wrote to Mr. Charles Frizera, who's the acting administrator of the Centers for Medicare and Medicaid Services, quote, "We write to express our concerns regarding Centers for Medicare and Medicaid Services proposed changes to Medicare Advantage rates for calendar year 2010. The advance notices raised two important issues that, if implemented, would result in highly problematic premium increases and benefit reductions for Medicare Advantage enrollees across the country." So again, as short a time ago as last April, there was concern on the other side about cuts in Medicare Advantage program.
I wonder if the senator is aware, in Alabama, there's 181,000 people that are going to get their Medicare Advantage cut. In Arizona, your number you listed. In California, 1,606,000 people, seniors, who are going to have their benefits cut. Colorado, 198,000, they're going to have their benefits cut. Georgia, 176,000. Illinois, 176,000. Indiana, 148,000. Kentucky, 110. Louisiana, 151,000. Massachusetts, 200,000. Michigan, 406,000. That's exactly what Michigan needs right now, isn't it? For their seniors to have their benefits cut. Minnesota, 284,000. Missouri, 200,000. Nevada, 104,000. New Jersey, 156,000. The state of New York, 853,000. Ohio, 499,000. Oregon, 250,000. Pennsylvania, maybe, maybe not, because they may have got the deal, 865,000. Tennessee, 233,000, according to my numbers. Washington State, 225,000. Wisconsin, 243,000. I'd ask unanimous consent to list what the enrollment is by the CMS on Medicaid and Medicare Advantage enrollment as of August 2009 into the record.
And the point of all this is,
Without objection.
and the point of all this is that the senator from Florida, member of the Finance Committee, felt so strongly that Medicare Advantage was at risk that he decided to carve out and was able to get a majority on a party line vote of the Finance Committee to carve out a special status for a group of seniors under Medicare Advantage in his state. This amendment simply says that everyone that the senator from Oklahoma just made reference to has that same protection. That's all that this amendment is about.
If the senator would yield for a question, if this amendment does not pass, which protects all Medicare Advantage beneficiaries, all 11 million of them, 532,000 in my state, and as a result of not only these cuts, but perhaps 6 additional cuts to come in the future to Medicare Advantage, which make it harder and harder for Medicare beneficiaries to get coverage, I would ask our colleagues, particularly our doctor colleagues, what's the impact on eliminating Medicare Advantage and leaving people with Medicare fee-for-service, which is the, as I recall, the Bennett Amendment earlier, which is you have to parse the language closely. They talk about guaranteed benefits, but I think the senator from Oklahoma makes a good point. Right now, Medicare Advantage are guaranteed benefits, so we're going to cut those. But what's the consequence of seniors losing Medicare Advantage and being forced only on a Medicare fee-for-service program?
Limited prevention screening, no coordinated care, loss of access to certain drugs, accessory things like vision